Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great to have you with us again today. We're going to be talking about chiropractic care and blood pressure. Would you believe that it's possible that you could go to a chiropractor, and if you have the correct treatment and you have high blood pressure, that it might come down, that you may no longer need blood pressure medication? Well, we're going to take a look at that for you. And I'm going to cite an article that was out on WebMD, March 26th of 2007, and I'm going to quote that now. 25 patients received Atlas adjustments, that's the first cervical vertebra in the neck. 8 weeks after undergoing the procedure, 25 patients with early high blood pressure had significantly lower blood pressure than 25 similar patients who underwent a sham chiropractic adjustment. Placebo adjustment. X-rays showed that the procedure realigned the atlas, or the first cervical vertebra. There were examinations including pre and post X-rays. Now, what this is telling us, and the article then was reviewed by a medical doctor, Daniel J. D. Nolan, and also then reviewed by Louise Chang, MD, March 16, 2007. Let's talk about some risk applications now. We're not telling you in any way, if you're on high blood pressure medication or any other medication for that matter, to stop taking that medication. We're not implying that whatsoever. But the fact is there is an important relationship between initial and subsequent x-rays. These people did not go to a chiropractor that did not have x-rays of their spine. They did. And they were pre-x-rays as well as post-x-rays. Now, patient's x-ray status started a domino effect. Dr. Buck, this researcher, took an AP thoracic x-ray but failed to identify an obvious fracture. This is a malpractice situation. The doctor, the chiropractor, did not x-ray before the adjustment. There was a fracture there prior to that, and it caused problems. So now, how is it possible that a person could have high blood pressure, go to a chiropractor, receive chiropractic care, and have their blood pressure go down? Now, Dr. Jensen is going to take you on a little scientific trip of this, and he's going to start by showing you an x-ray of a side view of the mid-back or the thoracic spine.
Thank you, Dr. Lala. Well, when we look at this x-ray here, we can see, let's bring that x-ray up. What we can see is the thoracic, the side view of the thoracic spine, and we look at T5. T5 would be that which is connected with the heart, the control of the heart from the sympathetic and parasympathetic balance of the heart rate would come through that area there. And right up in front of here, this is where you're seeing the mediastinum, which is a section of lots of little things going on in there, where the bronchioles split into the lungs, and you've got the stems that the heart is attached to. So we're looking at the heart shadow here. And if you have too much of an arch back here, you could be compressing the heart, for one. If you have a sideways bend, a scoliosis, you could be putting pressure on the heart also. In this case, we can see a little bit of degeneration of the discs, and usually when that occurs, you start to have degeneration of the posterior parts where the nerves travel out from between the two vertebrae and can therefore be affecting the signal that either speeds up or slows down the heart, and therefore could be affecting the cardiac output that takes place there. Now, what we're looking at is this chiropractic looks at the structure or the frame of the body, and so posture is very important to us. And here we're looking at a normal posture, where you see there's a line that bifurcates through the center of the body, goes through between the eyes, the nose, the chin, the center of the chest, through the center of the waist, the pelvis, and all the way down to the center between the 2 feet to show where the gravity line would be. The same thing with the posterior view. It's separating out quite well. On the side view, it travels through the ear, through the shoulder, through the hip, through the knee, and just in front of the ankle.
And they can leave that slide up there. I really hope that if you're under chiropractic care, that not only is your chiropractor making x-rays of your spine, but also that they're making digital posture pictures of you. I know we do that in the clinic, and it gives us we do that initially and then subsequently aftercare to see if structure is changing externally as well as post x-rays internally, right?
Absolutely, and what it does is it gives us a benchmark to go from.
That's right.
And what we also do is we usually take a video of the patients walking up and down the hallway so we can see a gait analysis. And what we can see is after treatment, how their balance, their function of the frame of their body is actually working that much better.
Yeah, there is nothing more important than your body. If you don't take care of it, it's not going to take care of you. So continue, please.
Here's a point. They say that the first so many decades of our life, we sell our health to make money, and then after retirement, many times we're spending our money in order to buy back our health, and where it's much better to take care of it all the way through, because you may gain the whole world and lose your life. That's not right either. Let's go back to the slides here, and what we have here is a picture of the spine and how it's positioned within the body. The top 7 vertebrae up here are related to the neck. It's also called the cervical spine. Then we have the middle part here. It's called the dorsal spine or thoracic spine. That's the spine in which your ribs are attached to. We have 12 of those. And then the bottom 5 down here are have the curve in the low back. That's the lumbar spine. Their structure is made so that they can take more weight than the others. And then we have down here we have the pelvis, which is composed of actually a number of large vertebrae that all sealed together forming the sacrum, and then 2 bones out to the side, the hip bones, which are the iliac bones, and then bones down here that fit together. These are the pubic bones, and then there's the ischial bones back over here. So these 3 bones all form this area, and then the sacrum. So that's where we get to see our structure. If we look at this is like an arch in those old buildings. They have a stone arch, and in the middle of that arch they have a keystone. And that keystone, so that the legs come up and push through the femurs, these bones, right into the sacrum. So it's architecturally sound also. So then when we look at architecture like that, let's look at if we have a leg that it may be short, either physically short, in that it's actually short from a point where some people have fractures and things like that, that's going through a growth center. But most of the time we see where a person will have a fallen arch or something like that that makes it functionally short. And when that happens, it tilts this base right here, and in tilting that base, the spine then comes off of that base, tipped towards the right in this case. The body then responds by bending back the spine, and usually over responds, and then has to bring back the head. So we'll usually have a couple of curves here. And the reason why it does it tries to keep your eyes level with the horizon. Because if your eyes are tilted with the horizon, let's say you're running away from that proverbial tiger, with your eyes tilted, it's hard to stay upright, and therefore you fall down and the tiger catches you. So it's very important in these righting reflexes to right the eyes with the horizon.
Because the majority of the new patients that we see have already been to chiropractors or physical therapists or massage therapists, and we find that 90% of those patients, the chiropractor has never taken an adequate case history, never made spinal x-rays, or if they did, they were not really adequate x-rays. And thirdly, that the patient had a short leg, either functional or anatomical short leg, and the chiropractor never did anything about correcting the short leg or pronation or supination of the feet. Therefore, every time that patient walks out of the clinic after treatment, they're going to walk out and lose the majority of that visit. No wonder they have to keep going there as often as they do.
Absolutely. If we go back to that slide for one thing I want to show you here is what we find is because this low back being off like this, being off like that, it translates all the way up to the spine. So you know that old saying that the buck stops here. Well, that's the last joint, and it stops right there. And many times, that joint affects the blood vessels
right.
going up into the brain.
And that's the atlas vertebra at the top. It's like Mr. Atlas holding the globe up. And that's all of the nerves coming out of the brain stem, the medulla oblongata. That affects every cell right down to the tip of our toes. And that's the vertebra that they were adjusting that caused the blood pressure to become normal.
Right, and here, let's look at it this way. We have some of our cranial nerves are formed up there. All of them are formed up there. And the cranial nerve that goes to the ear, is the vestibular cochlear nerve. The vestibular section of that, what we find is an adjustment in the spine, particularly if C1 there, could take stress off of that, but also what it does is it signals the vestibular nucleus to reset the tone of the muscles throughout the body. And that includes the tone of the vascular system. Arteries have muscle surrounding them. And so that can definitely reset the blood pressure.
Right, and the key is that you don't want somebody manipulating your occiput or your atlas or axis or any other vertebra or bone in your body without having good x-rays of it. It's dangerous to do that. It is. I know a lot of chiropractors are doing that, but it is dangerous to do that. Dr. Jensen is going to bring up the brain, because we're talking about the brain and the brain stem and high blood pressure here now.
Okay, as we're looking at the brain here, this is from the bottom of the brain. We're looking upwards onto the brain. This is the brain stem, okay, and here we have the vertebral artery, which comes up alongside both sides of the brain. It comes in here, and then we have a circle here. It's called the Circle of Willis, after the man who discovered it. And what happens here is the Circle of Willis is designed to allow blood to continue to travel to all parts of the brain. Even if you had an occlusion in one of these areas, blood would be able to make itself around and still to fill in that area. So there's lots of redundancies here in order to keep the blood flowing to all portions of the brain. And of course, those being arteries would have muscular tissue denoting how constricted or dilated that they are. And that's, again, we're looking at the cranial nerves come off in this area as well. And so that adjustment of the C1 area is very effective in helping to regulate this. Then if we go on, we have the lobes of the brain. And the lobes of the brain affect different areas. This is why if somebody's had a stroke, they want to test to see what they can do. It tells them which area of the brain was affected. So here we're looking at the temporal lobe, and that's primarily with hearing and speech and coordination of some of our auditory areas. We're looking at actually coordination comes from the cerebellum, and that's when we get drunk. This stops working as well, and so that becomes the coordination in speech as in walking. So they get that ataxic gait, that drunken gait, as well as slurred speech from that area.
And many times that is so minimal that they're not aware of it. But when we make the digital moving picture x-ray, we can see that there are some not only postural alterations, but some gait manifestations that may not only be related to the feet and the spine, but to a lack of proper blood supply going to the brain because of problems up here in the neck.
Oh, certainly. It's a journey of discovery for these people, because once you point it out in them, not only, one, they become a little self-conscious, but two, they start to see it in others surrounding them, and start to notice those kinds of things. But you never really look at yourself walking.
There's really nothing worse than a good old boy doctor or a good old girl doctor, because it's all personality and they're not doing their diagnostic workups. They're just a good guy or good gal. Oh, the doc loves, I like the doc, you know. Well, those people are usually the ones that are doing the lousiest jobs.
Well, as we go back into this now, we're looking at the brain with
Is that brain stem?
the frontal lobe, the cerebellum. This is all your conscious work, and we're looking at the visual centers. We're looking at movement and sensory up in here, as well as whether they're able to make judgments. Correct judgments can be from down in here, as well as making plans for the future from up in here. So you can start to see what's going on with people as to what's going on with their symptomology. Then we look at the organization of the brain and how we have so much of the brain that's coordinated to certain areas, certain tissues of the body. Look how big it is for the hand as it is for the entire rest of the body. So that's a huge component that is just in the hand alone, and we're looking at it from left to right. This is motor activity here, and this is sensory activity here. And you're looking at just the fingers down here is huge also.
Could you, before we do that, could you bring that brainstem, that lateral view back up again, please?
Sure.
There you are. Point out the brainstem.
lateral.
Point out the brainstem to them.
Brainstem is
right
down
there.
here.
That's the brain stem. That's what's passing through your atlas and your occipital bone, the back of your skull bone. And that's where the atlas is. And if that atlas is not in proper alignment, it is going to cause dysfunction of every nerve, every artery, every vein, every lymphatic, and every acupuncture meridian in the human body. So now let's go on here and look at those cranial nerves that you just had up. The cranial nerves affect the head, our neck, our eyes, our ears, sense, organs, glands, blood vessels of the brain, immune response, bone growth, fat metabolism, stress, and brain function. Now we're going to look at a couple different dimensions of the nervous system now. We're going to look at the peripheral nervous system now. So we have three nervous systems. This is the peripheral nervous system up at the lower neck and upper back. That's the brachial plexus up there. It's like a root of a trunk of a tree. And in the lower back, it's the sciatic or lumbar plexus. That's the
Brachial plexus.
up there, and there is the lumbar plexus. Now we're going to look at another nervous system. We've already looked at the brain. This is the autonomic nervous system. This is the one that we don't think about until our blood pressure goes up, or we have breathing difficulties, or visual problems, or hearing problems, or digestive problems. Autonomic means automatic. It functions all by itself. But again, all of those nerves of those three nervous systems are housed in either the brain, the cranial vault, or in the spinal canal. The spinal canal is like a big tunnel. And now Dr. Jensen is going to bring up another slide, and we're going to show you an illustration of how those nerves get out of these windows or holes in the spine.
One of the things I wanted to relate before we leave this is right here. There's the parasympathetic nervous system and the sympathetic nervous system. The parasympathetic nervous system is right here, and that will actually slow down the heart, okay? Then you have the sympathetic nervous system, which comes out from the spine, and this will speed up the heart, as in for fight or flight. So if we have a problem with a subluxation here, we can actually be facilitating this nerve, making it stronger, and speeding up the heart, increasing our blood pressure just due to cardiac output. Now, a subluxation is found in this slide.
Right, and so we're looking at an illustration here of some vertebra, and we see the top one there is in normal alignment. There's a disc, a blue disc between it. Then the one below it here now is a subluxated vertebra. It happens to have gone posterior, and it is pinching down, putting pressure on the nerves, arteries, veins, lymphatics, and the acupuncture meridians that pass out of those tunnels, those windows. And so the one here that he's pointing out now is a healthier, that's one who's, could be illustrated like what happens when it starts to die off or it's impinged. The vertebra below shows it in alignment. And of course, the x-ray is the thing more than anything else that shows us if the vertebrae are in alignment, out of alignment, and they are a blueprint to tell us how to manipulate, to adjust those vertebrae back into alignment. Dr. Jensen has some other pictures of vertebrae that he's going to show you now.
Okay, so this is a model of two vertebrae. It's called a motor unit in that a motor unit includes two vertebrae and the disc and the joint in between. Motor unit means this is an area of movement in here. But what happens is when this disc either undergoes degenerative changes, many times it becomes a pinching in the back here, and this window where this nerve comes out starts to have pressure against it. The first thing that gets occluded is actually the artery to the nervous system gets occluded, the first thing coming in here, and that can affect levels up or down from here. So it's not just this window that's being affected. It's like 2 above and 2 below, so that's 5 total in there. And then the other thing is when you push on a nerve, the first thing that happens with a nerve when it gets pushed on is it actually facilitates it, makes it more active, and therefore it can make muscles constrict or the heart beat faster. Then after it's been constricted for a long period of time, it starts to impede its use and it starts to be slower. And so now the heart has a harder time reacting to a stress that should be beating faster, and it's not able to do so, and therefore you become weak and you can't react to the stress as well as you would, or even sickness or illness. Now, as we look at this, we can look at it from the top. Here's the spinal canal and the 2 nerves coming off from the side. Here are the joints for the vertebrae. Come to the side. Here's those 2 joints again. Spinal cord going through the spinal canal. The 2 nerves coming off from in between them. And then as we find what happens is there's muscles here that might be tightened and loosened on another side, which creates that movement, but also tight muscles, chronic spasms in there can make this bend that can cause a subluxation. A widening of this joint or an inflammation in there can cause a widening of that joint and have a configuration like this. So if we go back and forth, you can see the changes there that can take place. And the chiropractic adjustment works very well on those joints to help modulate the nervous system. It's actually, chiropractic is always judged to be mostly on bones. But what we work with is the nervous system. It's just that the bones are the medium in which we're able to affect the nervous system through it. So here's some alignment of these bones as we check the alignment. Usually on x-rays we can check whether they have a wedging here or whether it's straight across, or we call this a load moment where it's coming up and all of a sudden it drastically changes direction. And usually that's a point where weakness has taken place when it's of a greater angle than some of the other angles. Some of the angles are just movement to coincide with what's going on down in here. So this would be a primary subluxation. This might be a secondary subluxation. Another x-ray showing here, if you look at the ribs on this side, these ribs are spread apart, and the ribs over here are close together. Now, one of the things that we do in chiropractic is the way that we shoot x-rays, it's almost universally that the left side, the side with the heart shadow here, of course, that the left side is on the left side. So you're looking at this person as though it's from their back. And what you can see here is the heart has much less room over here than it would if it's over here. So you've shrunk down this lung and you've shrunk down the heart. So it may not be beating as well, and it may cause some stress on the body, making high blood pressure also a result.
Here we're looking at a normal lateral view of the cervical spine, the neck. That's on your far right. There's a nice gradual forward sway there. And then the larger picture on your right, the one on your right is the normal, the one on your left is where the neck has lost its normal forward sway. So that's going to adversely affect the alignment of the vertebra. When the vertebrae are not in proper alignment, it's going to affect the nerves, arteries, veins, lymph, and acupuncture meridians. So that's the scientific basis there, or part of it, that if the chiropractor finds those things and is able to correct them, then it's logical the blood pressure should go down if it's not some problem in the heart itself. Now the next slide brings up what is called the first thoracic vertebra. This is at the very lower neck. The areas that influences are the heart, or T2 here. It influences the forearm, the elbows, the hands, the wrists, the fingers, the throat. The effects include breathing problems, asthma, cough, apnea, and heart palpitation or heartburn. Now the second thoracic, here areas of influence include the heart valves, the covering of the coronary arteries. Effects include functional heart conditions and certain chest conditions. Now Dr. Jensen is going to bring up a picture of the heart itself or a cross-section, and he's going to give you a little explanation of what that means.
Okay, so when we're looking at the heart, we have the returning blood to the heart, which comes to the superior vena cava or the inferior vena cava. Okay, this is a vein, its blood is coming back to the heart. It empties into this atrium right here. And what happens is a 4-chambered heart, remember. So the first chamber is an atrium. and that empties down through this valve into the ventricle. This ventricle then, next pump, pushes it all into the lungs through the pulmonary artery. Then as it returns from the lungs, it comes into the other atrium on the left atrium, and that then empties into the left ventricle, and then that ventricle pumps it out to the rest of the body, coming up through the aorta. Here's the arch of the aorta.
Let's bring up that the osteoporosis slide, this one here now, okay?
Okay.
So what we're looking at here on your far left, it would be a normal illustration of posture, the nice forward sway in the neck, a slight rounding between the shoulders, and a slight sway in the lower back. Now this is a chart we use in osteoporosis and osteopenia, but with reference to high blood pressure and the spine, when that spine, see that illustration there is they're getting excessively humped, they call that a thoracic hyperkyphosis. That changes the dynamics of the spine on the heart, the lungs, et cetera, et cetera. So if that heart has to push harder because of the pressure of the spine being out of alignment, then the blood pressure is going to go up, and then as you look to your far right, you see so many people like this. And what we're trying to do is that if somebody comes in and they're already at the center stage, at least we have an opportunity to stop it from going to that third stage on your far right. Now let's take a look at the next picture, which is a real graphic illustration of a gentleman. You see a lot of people like this. This is that third stage. There's already some collapsed vertebra in this patient's spine. We're still able to adjust him without any problems. Still, we did blood work and things of that nature to adjust his minerals and his vitamins. But see, that was a high blood pressure situation, a heart situation. You look at that hump. It's just on your far right. It's pushing on those, on the heart and the lungs. And then next is we see the x-ray of the individual on your far left. You can see the curve in that spine. Dr. Jensen is showing now the arch of the aorta, or what they call the knob of the aorta. There's tremendous pressure on that, therefore it's difficult for the heart to push that blood out, therefore the blood pressure is going to go up. Same thing, the blood pressure is going to go up if we have atherosclerosis because it's harder to get the blood through. Then, looking at the next x-ray on your right there, you see it's all bent forward, it's all encroaching on the heart and on the lungs. So if we would conclude this for you, to see is to know is to correctly manage, to not see is to incorrectly manage. God created you to live a long life in good health. He really did. And it's true. We need to be spiritually born again in Christ Jesus, and there are these supernatural laws of healing that we can invoke upon ourselves when we are born in Christ Jesus, as well as natural laws of health and healing. The Lord wants you healthy, regardless if you know Him or not, through His Son. But to have those supernatural laws working in your life, you have to know Him through His Son. And it is a simple thing. It's not by joining a church. It's not by keeping a bunch of religious laws or rules and regulations. It's simply by believing, by saying, I'm going to put my belief in Jesus as my Savior. I may not know much about Him or understand, but I'm going to take that step of faith. And as soon as you do that, His Holy Spirit, the same Spirit that indwelled Him and empowered Him while He was on earth, comes into your spirit, and your spirit becomes born again. Your body and your mind doesn't yet, but in unison of Holy Communion of your spirit and the Holy Spirit, then it begins to affect your body and your mind. So yes, it's good to try and use the natural laws for health and healing, but it's far better to use them superimposed by the supernatural laws of health and healing. Great to have you with us again.